Good afternoon. My name is Lynette McGregor. I'm a pharmacist here at the Gaspé Hospital in oncology. I'm going to go through with you today what exactly chemotherapy is and how we prepare it here at the hospital. Cancer is basically an overgrowth of cells. Our body consists of cells, and unfortunately, cancer is an overproliferation. So the body creates too much, and it's on an uncontrollable rate. We use chemotherapy to try to stop the growth of these cells. So cancer cells tend to overgrow. And so with chemotherapy drugs, they're medications that go inside of the cell to cause destruction of that cell. Unfortunately, we have not developed therapies that are just targeted to cancer-only cells. We also have other cells in our body that divide rapidly, which go along with a lot of the side effects that we get from chemotherapy drugs. So hair loss, diarrhea, the bone marrow cells, which are responsible for us to give us energy, the red blood cells, white blood cells, which are a defense mechanism and prevent us from getting colds or down with the flu. Those are the cells that are responsible, that divide rapidly as well too. And unfortunately, the chemotherapy will as well target them and can put you at risk for anemia, so a red blood cell loss, which can make you feel fatigued. It can put you at risk for infections, so they're easily transmitted in your period where your body is weaker. So as a team, not only do we morally support you, we also support your blood counts as well too, which means we will take a blood test, sometimes weekly, depending on the regimen, sometimes immediately prior to the treatment, to see if your body is apt or able to receive the treatment, because we will not be doing the patient any favor if the blood counts are too low. So automatically we look into this to make sure that the body is at an adequate level. If not, we do have certain medications that can be given to support the patient during their next treatments to prevent it from going as low as it did. We can also give blood transfusions as well too if the need be, but not all patients require this support. So it's really on an individual basis, and we have to see every patient's different, and we see from treatment to treatment how it progresses and how the patient does. So when you come to the department here, you will meet a lot of healthcare professionals. I'm the pharmacist here, one of the pharmacists. You'll meet the physician, as well, probably the nutritionist, and the nurses as well on the floor. We prepare, actually, when it comes to the medication part of it, we prepare your medication in a separate part. It's not done on the oncology department. It's done downstairs in the pharmacy. There's a sterile hood, so the preparations are very strict because we also have to protect the people preparing it so that they're not exposed to the drug, and as well for your safety as well too, to make sure that it's sterile and there's no bacteria in it that could put you at risk. And then once those are being prepared by a technician, once they're prepared, I'm able to see on my computer screen here on the left, I'm able to visualize the exact drug to make sure it's in the right dose, the right patient. So I also have a label here as well too, and to make sure that the quantities are exact that have been prescribed for you. So once the prescription has been given to me, I will calculate it, or my colleague will calculate it, and then I upload it onto the computer, and then once it's filled, then it gets delivered to the floor and then off to the chemo department, where then once you will receive it by the nurse. We as pharmacists then sit down with you at every treatment, and we'll discuss and we'll go over side effects and any of your concerns. And then following that, when you go home with your family members may assist in the process as well too, because we do know that the patients don't absorb all the information that is given in that day, and we don't expect you to. But our information is on there and our telephone number, and you can feel free to contact us anytime during your treatment in the event that there's a question that's raised, or you're not understanding something, or you're not you're not sure on how to take your medications, please feel comfortable to do so. We're here from Monday to Friday from 8 to 4, and on the weekends, it's recommended if there's something more serious, you have to go to the emergency department. If you have a fever, for instance, that's something that cannot wait until the next day, or even during the evening, so from Monday through Friday, but after 4 o'clock, we recommend that you do go to the emergency room if it's something that requires medical assistance. However, we do work in close conjunction with your community pharmacist. So your community pharmacist is aware of your treatment. We fax them at the beginning of all of this process, and so they're aware of what protocol you're on. So don't hesitate to contact them either, because if we're not available, they may be able to answer your question that you have at hand. So I hope this video helped to enlighten the process in coming into the clinic, and helped you to understand if it's before or during or after this process, just to give you a better idea and to understand what we do here, what chemotherapy does, that you can receive it in many different forms. It can be given via injectable. There's also a misconception that it can't be given orally, but it can be given orally. With the advancement in research, we have a lot of therapies, protocols given orally. So like I said again, if there's any questions, don't hesitate to call.